point, we are going to have a briefing on oral health risk factors and systemic connections. Jim, you are leading it off.
Right. The committee felt that over the last several years we've heard a lot of testimony on fluoridation issues, but very little knowledge really beyond that of what oral health is all about. And the public seems to have a misconception about oral health sometimes in terms of they view oral health as the disease of cavities, and the way to prevent that is not to eat candy. Well, it's not quite that simple, so we thought we would take an opportunity to look at oral health in the greater sense of oral health and its connection to systemic health. And so we've invited Dr. B. Gandara, who's the Department of Oral Medicine at the University of Washington, to come and lead things off for us to help give us a little bit more background.
First of all, I want to thank Dr. Sledge and the board for allowing me to share information here, and Tara for helping facilitate with the slides. And I just want to give a little bit of background about myself. I graduated from USC School of Dentistry and afterwards did a hospital residency at the VA hospital in San Diego. Came up to Washington to do the oral medicine program, was on a geriatric fellowship, and in the past 30 years have worked at Fred Hutchinson Cancer Research Center, in our dental urgent care of the disabled clinic. I've been hospital attending, going into being on call with our residents on the weekends, so I have familiarity with the hospital ER and the dental emergencies that come in through there. And also for over 10 years was director of our dental urgent care clinic. And the reason I want to share that with you is because I want to let you know that I've seen a lot of oral disease and I've seen a lot of systemic disease and the impact that they have on each other. It's big, and the two are really inseparable. By oral health, I mean not just teeth and gums, but the soft tissues of the mouth and also the temporomandibular joints, the whole apparatus. With systemic health, by that I mean it's the body as a whole, not the individual parts. And it's really odd that for so long we had oral health and systemic health kind of considered independently, and we never think of stomach health and systemic health. We think your stomach health is going to affect your systemic health, and in fact the mouth is part of the gastrointestinal system. It's connected with the stomach as far as systems go. When you have oral disease that is advanced, that's not treated, then, and all these oral diseases are primarily infections. I'm going to stay away from cancer, which is kind of a huge thing of itself and obviously affects the rest of the body. But as far as infections of the gums and the teeth, they can result in tooth loss. And if you have loss of teeth, that impacts one's ability to eat, to socialize, to concentrate in school. And so for young kids, it's going to affect growth and development of children. And it also is going to impact healthy aging for the older adults. So this is oral disease causing systemic problems. In the other direction, systemic conditions also affect oral health because the mouth, again, is connected. And actually even a larger issue, probably more common, is that the treatment of systemic conditions can affect oral health. And I'll spend a few minutes talking about that. And then finally on this slide, I want to make the point that if somebody has a systemic condition, they actually cannot just walk into a dental office and receive care. Sometimes they need specialized care, whether it's attention to having a fragile immune system or just the ability for a child to sit in a chair because of special care needs. And so that's important to keep in mind as well. I'm going to concentrate on the two most prevalent oral diseases, caries and periodontal disease, because they are the ones with sort of the biggest disease burden for our society right now. And in addition, I'll spend a couple minutes talking about the lowly spit, which is actually very important because inadequate amounts of saliva actually increase the risk of having caries and periodontal disease, as well as affecting the lining of the mouth, the mucosa of the mouth. So starting with caries, periodontal disease, they're both infections. Caries is a transmissible infection caused by aerobic bacteria that makes holes in the teeth And then if the infection actually gets to the nerve and gets into the body, it can cause infections elsewhere in the body. The transmissible infection raise the age group a little bit up to third graders. We find that 58% of them have tooth decay that's in a baby tooth or a permanent tooth. So that means that requires money to fix, and not everybody can afford to fix those. And these are the ones that will progress to become infections and possibly infect their general health. Caries is also common in older adults. Nearly 1/5 of older adults in Washington State have untreated dental caries. Part of it is they have higher risk factors for caries, which I'll talk about in a few minutes, and then less access to care. Maybe they don't have dental insurance anymore. So speaking of risk factors, obviously Dr. Sledge referred to people thinking, oh, you don't brush your teeth, you're eating too much candy. And for sure that's a major part of it, having high refined carbohydrates and having poor oral health. But it goes so much more beyond that, especially when we're talking about systemic health. I mentioned spit, saliva, and there's a lot of diseases and treatment of diseases that cause low salivary flow rates. So it's directly tied in with the medical status of a patient. Also, especially for young kids, if they've got systemic diseases that require them to take medications, a lot of times these are made more palatable for young kids by making them more flavorful, more tolerable. So in addition to possibly having dry mouth because of having a disease, diabetes, some type of autoimmune disease, if they're taking a medication that has a higher sugar content, then this will contribute to the cavity problem as well. So how do cavities impact systemic health? Well, obviously an infection that is not treated can spread to the rest of the body, can go into the brain, kid has to be hospitalized and may or may not, if the infection is bad enough, overcome that, or induce great cost, as far as antibiotic treatment and so forth. Caries, if not treated, leads to tooth loss, and if you lose teeth, you can't eat well. If you can't eat well, then you're going to impact your immune system, and it can lead to other conditions like diabetes if you're eating foods that are highly processed foods and high refined carbohydrate content. And again, as I mentioned, if it affects speech development, difficulty concentrating in school, obviously this is going to affect the psychological health of young kids as well. In this photo here, we have a young child who I don't think you may not be able to tell from the photo, but all the upper teeth are with stainless steel crowns, and oftentimes those have to be put on a child that young who has to be hospitalized or has to have sedation, which comes with its own risks. They're tiny little bodies, and sometimes there's sedation mishaps as well. But in addition to that, this child is just getting fluoride, protective fluoride applied to the teeth, but she's terrified, and she's had, not very positive experiences with her teeth or with dental care. So you think about what type of patient or how her dental health will be as an adult. And this is the type of patient that has a high risk of coming into our emergency clinics with several teeth missing, and then needing another tooth, not having money for it to be fixed, and then another extraction. So the cost of caries is that in a young child, if it's really extensive, as I mentioned, it may require sedation or to be done in a hospital operating room, and the average cost for a session like this is about $10,000, including hospital costs, anesthesia, and the dental work. Again, there can be risk when somebody is sedated or it goes under general anesthesia. I mentioned that I was a hospital attending for our residents. I can't tell you how many times we saw people come in with really bad infections, and they have not been able to find a dentist maybe to treat them, or they don't have dental insurance, or they just waited till it was so painful and the infection got so bad that they come into a hospital emergency room. So something that if it had been prevented at the very beginning, when it was a small cavity, or even if it got to the point of extraction, if they had had access to dental care, ends up becoming a very expensive medical cost because of the ER-related visits. And this happens again and again and again. I'm going to switch over to periodontal disease now, which is actually a chronic infection, again, inflammatory infection that's due to a slightly different type of bacteria predominates in these infections. And this is caused, like caries, by dental plaque accumulation. and affects primarily the supporting structures of the teeth, the gingiva and the bone that support the teeth. So the characteristics of this, and this is a fairly advanced example, is light colored deposits on the teeth, and common terms for this are tartar, calculus, and these are initially soft, but because of calcium in the saliva, they become mineralized, and then they become very tenacious, and then they require professional dental care for removal. It's very hard for a person to get that off with just a toothbrush or any kind of home device. These are full of bacteria, and they cause bleeding and redness of the gums and the gingiva, and eventually tooth loss. And when you lose teeth, then you start to have a drifting of the teeth. And again, as I mentioned, when you don't have enough teeth, you don't eat well, and if you don't eat well, you're not going to be healthy. And that's in addition to having infections. So I'm going to talk about infections here for a minute, because in periodontal disease, it turns out that there's actually, we think of our mouth as a little area, but if we think of all the contact area that all the areas around our teeth have with bacteria, chronic infection, you actually can have a lot of things going on. And what happens is that the bacteria that are down in these pockets around the teeth, I forgot to emphasize that with this continued attachment of plaque and tartar development, the gum starts to separate from the teeth, and you start forming pockets. And at the bottom of these pockets, you have this anaerobic bacteria, and you have this inflamed tissue. So then you have interaction between the bacteria and now your blood system. And it turns out that these infections actually create chemicals in the body, inflammatory chemicals that can activate inflammation and infection in other areas of the body. And it actually, the periodontal disease has been linked to atherosclerotic vascular disease, which is a disease that causes heart attacks, which causes strokes, because these are plaques that form in blood vessels. And it also is highly correlated with diabetes. So this is huge, because atherosclerotic disease is the #1 cause of death globally and in the US. And diabetes is super, super common. It affects nearly 500,000 adults in Washington and is responsible for a large part of our medical costs. So periodontal disease and diabetes, there's been the most research that has been done in this, and right now it's to the point where many consider periodontal disease a complication of diabetes. It's a two-way relationship. Studies have shown that if periodontal disease is in a diabetic person and it's not treated, in other words, they've got chronic infection, their gums are bleeding, they've got plaque, bacteria down in these deep pockets, that they actually have a harder time controlling blood sugar levels. And poor glycemic control, glycemia being blood in the sugar in the blood, it leads to increased complications of diabetes, which are kidney disease, blindness, problems with circulation in the extremities, and cardiovascular disease. And in the reverse direction, if blood sugars are poorly controlled, then people have a hard time keeping their gums healthy. So what this points to is that it's important to treat both. If you treat both, then you have a chance of improving glycemic control and periodontal disease. The other way around, with it not treated, you have sort of a vicious cycle where one is feeding the other. So costs of periodontal disease, similar to caries, tooth loss, poor nutrition. And in addition, you have, again, impaired health due to poor nutrition and chronic infection, and as I said before, the complications that are commonly recognized in diabetic patients, having to do with kidney disease and extremities and blindness and so forth. So the benefits of preventive care of periodontitis, and where I'm leading with all this, is how important it is to get this at the very beginning before it becomes hospitalization, is that you actually save money as far as healthcare. So in studies that have been done, they found, and this one was nationwide, not just Washington State, that if you compare two populations, diabetic patients with dental care and without dental care, they found that there was lower average annual medical care costs of about $18,000, and between 10 to 40% in general lower medical costs. And so this is just money, this is dollars. It also, if there have been studies looking at hemoglobin A1C, which is a blood marker for glycemic control, and I'm not showing the data for this, but actually they found that in populations that receive dental care, they actually have lower levels of this blood marker for glycemic control. So that's important too, especially for people who do research and care about these kind of indicators of disease. So I want to spend a few minutes talking about saliva because it's something that we often take for granted, and when you don't have it, then you have the repercussions of that. And so saliva is secreted from our salivary glands. We've got several major glands and a lot of tiny glands in our mouth, and it's very, very protective of oral tissues, the teeth, the gums, and the soft tissues. If you don't have enough of it, then you are at increased risk for cavities, gum disease, periodontal disease, and again, soft tissue lining of the mouth. So I want to spend a little bit of time talking about what causes these, because this is highly related to systemic disease. The major cause of low salivary flow is medications. That's the absolute #1 cause. And second, less commonly but important is autoimmune diseases like Sjogren's syndrome, and it's fairly complex, so I won't go into that, but basically you get inflammation in the salivary glands and the tear glands and end up having dry eyes, dry mouth. And then real obvious cause would be cancer therapy. If somebody gets radiated in the head and neck area, it actually can damage the salivary glands so that they don't function as well. But I want to go back to our #1 cause of medications. And I want to thank Chris Baumgartner from the Prescription Drug Monitoring Program who gave me this data. And what this list shows is some of the top prescribed medications in Washington State, and this is data up to April of 2012. And I've highlighted the #1 prescribed medication, which is narcotic analgesics, so Vicodin, oxycodone, opioid medications such as the ones I just mentioned. Atheractics is a term for antidepressants and anti-anxiety agents. If you look down where it says 12 is a category of the disease, amphetamine preparations. So this is really high number too. And the drugs that fall into this category are drugs like Adderall. And we have a lot of kids with attention deficit disorder and adults who are taking this type of medication. Sedatives also are highly prescribed, and as I said, the antidepressants. So the reason I point this out, because all these drugs have one of the major side effects is causing dry mouth. And if you take that, know that you can have this effect if you've taken narcotic analgesics for short term or long term. So, and a lot of people are on them for long term. So here's a map of the state of Washington, and the darker colors refer to where there is higher use per person. And I just find it interesting because these areas where there's high use of and this one is opioid medications. There's actually a map like this for antidepressants and stimulants and so forth. And the oral medicine part of me wants to show them to you all, but the time part of me says, let's just show you the opioid, the #1. But these corners where it's darkest is actually where there's the least access to dental care. So I find that kind of interesting. We sort of a double whammy. And again, the most commonly prescribed medication, now taking a specific drug, is hydrocodone with acetaminophen, otherwise known as Vicodin. And again, major side effect of xerostomia and dry mouth. So what is the cause of dry mouth? 1 in 3 adults have dry mouth, mostly due to medications. It causes difficulty eating, swallowing, speaking, difficulty wearing dentures. So if you don't have teeth, it doesn't mean it's not a problem. You can't even wear the dentures very well. If you do have teeth, it causes cavities, particularly at the gum line area. This is a problem for senior folk because they've got recession of the gums, and they get very prone to getting cavities at the gum line and teeth breaking off if they don't get taken care of. And periodontal disease, mucosal disease, and as I mentioned before, tooth loss. I want to address tooth loss specifically. About 38% of adults in Washington have had 1 or more teeth removed due to tooth decay. So the wording of that, I want to be a little bit more precise. It's 1 or more teeth as opposed to all their teeth removed. About 20% have lost all their teeth. As I mentioned before, even if you don't have teeth, it's very difficult to have a denture sit well in the mouth when the mouth is dry. And again, I don't want to belabor this point too much, but missing teeth or lack of teeth affect the ability to maintain good nutrition. People pick food choices that are easy to eat, and then those don't tend to be the healthiest. So here we have the situation where systemic disease is highly linked with caries, periodontal disease, and can cause dry mouth. As it turns out, actually, we can prevent these if we educate people about healthy eating, frequency of eating, how to brush their teeth, and this is kind of the mainstay of dental education. We need to provide access to preventive dental care, not just emergency care. I mentioned that I've been working in the emergency clinic of the dental school, and I can't tell you how many teeth we extract from young kids in their 20s and 30s. And they've got a long life to go, and we're already starting down the road to edentulousness because they didn't get preventive care. They're too old to get care, that the young kids get, and then we have other issues. It's complicated by medications that cause dry mouth, and some of them may be related to drug misuse as well. And other preventive programs like fluoride varnish application, water fluoridation programs. All these are important to prevent decay before it starts and periodontal disease before it starts. So in summary, I want to reemphasize that oral disease, including caries and periodontal disease, are interrelated in a bi-directional manner with systemic health. Oral disease generates high medical costs because of increased complications in diseases such as diabetes. So it is cost effective to treat oral disease to help save in medical costs. Advanced oral disease can incur high medical costs because of hospitalizations that are required if the infection gets out of control or if a young child requires care in a hospital setting. Systemic diseases or their treatment actually can cause dry mouth. So that's an important one. It's highly kind of under-recognized. So that can increase the rate of caries and periodontal disease. Oral disease that results in tooth loss affects the ability to maintain healthy nutrition, and which in turn increases the risk of systemic disease. And I do want to add that we also have some other social determinants that I have not gotten into, in that the availability of healthy foods. In the areas where disease rates are high, often in lower socioeconomic levels, we sometimes have nutritional deserts where you don't have stores that carry a lot of the foods that are more expensive that are actually healthy with antioxidants and promote healthy immune systems, but rather are highly processed and carcinogenic foods. So they're preventable with education, access to preventive care, and other protective programs such as fluoride delivery programs. And I want to add one more thing that's not on this list, and I didn't tell you about my background. I'm also the Director of Educational Partnerships and Diversity. So I work with students out in the community, providing care to people who don't have access to care, and trying to increase the diversity in the workforce. And I think that increasing workforce diversity also helps with the overall care of our communities with these high disease rates, because people from communities that are underserved, the dentists will tend to go back to those communities and actually are often the most effective providers because they come from similar cultural backgrounds and can educate and get behavior change better. But it's not only in that arena. Increasing diversity in research offers different viewpoints and actually can contribute to research, because all of this work that's come about the connections between systemic disease and oral health has come from research at the animal level, at the public health level, making the connections and seeing, and we're now at the phase of trying to see how can we prevent it, how can we treat systemic disease, how can we treat oral health so that they can we can have better outcomes in both of those arenas. And so I guess I'll stop there and I'll take any questions.
Do you have any comment about the Smile Mobile, about which I don't know much, but I see it visiting?
The Smile Mobile is, there's several sponsors. The one I'm most familiar with is the Washington Dental service. It's a van that goes around to different communities where it's been identified that there's high caries rate. So it's all over the state, up in Whatcom and Skagit County. It's on the Olympic Peninsula. Treats children only. And again, it's dentists volunteer their time, and sometimes there are some paid dentists, some are volunteer dentists. And actually our dental students are very active on that, volunteering their time as well. And we also have AmeriCorps/dental student members on that who are trying to set up regular systems so that our dental students can participate at an early level during their training so that they become the dentists who volunteer later. But SmileMobile has really helped a lot of young kids in the community because they provide the preventive services, fluoride varnishes, education about nutrition and taking care of their teeth. And sometimes that's where they can get it from. They may not be able to always get it from their parents. And so they try to make it easy to bring the dentistry to the communities.
Nice.
Actually, thank you, Dr. Gandara, for sharing this information. It's always incredible to me how late we have come to the realization that oral health and mental health is part of our physical health and wellness. And it's just, you know, everything that we do. And it's not all about fluoridation. There's also other things that you can do. And actually, I bet that the impact on decreasing prescriptions in general, unnecessary prescriptions. I was just involved in discussing our local prescription drug take-back programs, and the incredible, I think the entire last year in our prescription drug boxes here in Thurston County, I think we collected over 3,000 pounds of medications. You know, all of this is just stuff that people are now just throwing away. And the reality is we write, as physicians in this community, a lot of prescriptions.
It's really hard in the emergency room because you see people come in and they've got dental disease because they've got dry mouth and they're on drugs. So they have some legit reasons for having the teeth be in pain. And then they're saying, give me Vicodin, I need pain meds. And so as a provider, it's a real struggle because you don't want to contribute to the problem of prescription drug abuse, and yet they're presenting with conditions that are partly caused by the drug use. So thank you.
Pete, do you want to comment on the high use of soda pop in especially teenagers these days, and how that correlates with oral disease?
Yeah, well, actually with soda pop, not only is there high sugar content and it has direct effect as far as causing cavities, it's also very acidic.